Hey guys, we're going to talk about some organization and power. Um, if you'll note on your lecture student learning outcomes and outline, I listed a few YouTube videos. You might take the time to take a look at them. A few of them are kind of funny. We all need something to laugh about in today's day and time. So I did include a few of those in there for you. All right, so when we're talking about organizational behavior, I just need you to understand that this is a very basic undergraduate lecture over organizations and the powers that exist. As you start to transition through your educational career, you're going to see more and more of this for the emerging leadership role because as you advance your career, that's what it's about. It's about being a leader in nursing. I believe before we can delve into this lecture, though, I thought it was important that the student understand organizational behavior theory. And why talk about it, talk about organizations and the powers that exist if we don't even know about the theory that is applied to it. It's an applied behavioral science. It is a study of individual and group dynamics within an organization setting. Whenever people work together, there are numerous and complex factors that interact. OB addresses four questions. Why do people behave the way that they do when they are in organizations? Under what circumstances will people's behavior in organizations change? What impacts do organizations have on the behavior of individuals, formal groups such as departments, and informal groups such as people from several departments who meet regularly in the company's lunchroom, although in this COVID world, there is not a lunchroom that we all meet up in. Why do different groups in the same organization develop different behavioral norms? So when we want to start understanding organizations, we need to, in the context of early beginnings, we need to know that nurses have opportunities and abilities to work in an array of areas and facilities in healthcare. This is a given. There are different areas out there. I've talked about nursing informatics several times through several different lectures. If you haven't, you probably should look into it. It's pretty interesting degree program, certificate program to go after, and it can take you pretty far in today's world. I think with all the different areas of nursing available, this what it kind of appeals to us. Some of us may be content to work the floor and transition our practice to a more leadership administrative role. While others like the thought of being a legal nurse consultant. I kind of like that myself. Nurse educator, of course, I obviously like that, or I wouldn't be doing what I'm doing, right? You could be working in either uh, the hospital or you could be a school nurse. School nurses, by the way, there may be 700 to 1. Um, but it is an awfully rewarding career to have to be working with those children. Again, what about informatics? In knowing this, we explore our relationships in the workplace, the patient, the coworker, administration, and we determine what's the best fit for us. Wherever you go in your career, there will always be organizational power, though. Relationships with patients may last minutes to hours to days or months to or even years, depending on the area that you choose to work. If you're an independent practicing nurse, you may find yourself working for an agency and visiting many different types of facilities. Typically, the organizations are classified into three main types, which is based on who sponsors them and on what type of financing that they actually receive. So this is when we're going to start talking about our types of healthcare organizations. There is private, not-for-profit, publicly supported, and private for-profit. Differences between these categories kind of sometimes become a little bit blurred. What was that? Blurred lines? I don't know. Y'all are probably like, oh my God, did she really just sing that? But that's what just came to my mind. All these places, though, do compete for patients, especially the insured patient or ones whom they know that will pay their bills. All experience the effects of cost constraints. All may provide services that are eligible for government reimbursement, such as with Medicaid or Medicare funding, but they must meet those government standards. All deal with the rising cost of health care, along with the increasing complexity of patient health care needs. Baptist is, for example, a private not-for-profit institution. These organizations were founded by civic, charitable, or religious groups to meet the needs of a patient population. They need money to run, though, don't we all? However, they generally do not have to generate a profit, just need to meet their expenses. And this is many years ago. I tell this story. I came into work one night to be sent down to the back of the cafeteria and pick up my gift. That was the best gift I've ever received as a Baptist employee, just want you to know. Baptist provided us all with crisp $100 bills because we made a profit that year. It has not happened since, and I doubt it's going to happen ever again. In fact, most healthcare facilities, and I'm not just talking about Baptist, but in today's times, there are some COVID benefits, if we want to call COVID a benefit, but there are some benefits for COVID. There are some monies that have been received by institutions, been received by everybody basically, except, okay, I'll be quiet. Okay, so not political. There has been a lot of money that has been brought in from the government, and it has come down to facilities to help with the reimbursement needs of having to get extra PPE, for example. There are some benefits that have come down to the college and other colleges from the COVID stimulus. All right, so anyway, as I was saying, I will never see that crisp $100 bill again at Baptist. I'll probably get a chair or a water bottle or, a lunch bag or something. That's what we've been getting. Public organizations are government operated and would include a public health department all the way up to complex medical centers like the VA hospital. Increasingly, many organizations are changing their missions and becoming a for-profit facility. Heart Hospital, for example, would be an organization who operates for profit. Nursing home chains, health maintenance organizations, and many freestanding centers such as the surgical hospital are all for-profit institutions. So when we're wanting to understand organizational culture, when I was reading this textbook and trying to develop this lecture, I came across a statement in your text that said people seek stability, consistency, and meaning in their work. I couldn't agree with that more. I know that I seek stability, I want consistency, and I truly do desire to achieve meaning from the work that I do. If you go on LinkedIn, and I highly encourage you to start now when you finish your RN and as you go through your BSN and your master's, because you can have connections with other professionals. It is a platform to share things professionally, so you're not getting, oh my gosh, the COVID testing, da 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 da. You're not getting that. This is a professional platform. They'll share research documents, and it's not just nurses, it's other professionals, and then not just in medical professionals. I encourage you to reach out to people, and others will reach out to you because they're like me. They just want those connections professionally. They wanna see what you have to say, and they want you to see what they have to say. I hope that you all will achieve that desire in yourselves to continually want to to improve upon yourself. And you know what? I think you will. If you weren't planning to, you probably would not have gone any further than getting your LPN, but you chose to go ahead and further your career for your RN. And then you're going to further your career. I have no doubt you folks are going to move in through your BSN and your masters. Some of you are going to be DMPs. I'm going to see some of y'all as nurse leaders. I'm going to see y'all as nurse practitioners, and I'm excited to see each step of the way with my students. Culture in an organization is a set of shared values, beliefs, and assumptions, really no different than our own personal cultures. You may see this several times. I'm going to say it, and I know I've said it before. If the place you're seeking employment to does not have a philosophy or values that closely mirror yours, then you will not be happy. So you need to date them. You need to date the facility. Culture in an organization is not tangible. You can't touch it, you can't see it, but you can and you will feel it. When you're looking for an organization to be a part of, date it. I encourage students to do this every single year. How do you know your significant other was the one? I mean, how did you know? I married actually and divorced before I met my husband. We've been married almost 24 years. But let me tell you, I did date though until I found the one that was right. I couldn't just go willy-nilly. Oh, blonde hair, blue eyes. That's the one for me. That facade on the outside that's what I'm looking for. Because that's not what you want to do. You need to take a look on the inside. How's that person? They might be really, really cute and they might look really, really great to you, but on the inside, they are just very, very nasty. So think about those things. It's the same thing when we're talking about going to work somewhere. Um, don't, and when I talk about going on the inside, don't be sneaking in. I'm talking about you're going to go, you're going to make appointments, go to HR. And I think in this day and time, it might be a little bit more difficult to shadow, but there needs to be some accommodation. So, y'all been dating Baptist now for a full year. And some of you even longer than that because you went through LPN school. So you've been dating Baptist for quite a while. Whether it's a facility you want to work with or not. And if it isn't, then you need to move on and you need to find that place that just speaks to your heart and speaks to your mind. You go and you look on the inside and you check it out. You talk to people. You talk to people that work there. That's a good place to start as well. In any organization, there are at least 3 levels of organizational culture that have been identified. You have your artifact level, your espoused beliefs, and your underlying assumptions. The artifact level, and this is the visible characteristics of the organization. This is our blonde hair, blue eyed guy, okay, or girl. Patient room layout, the paint colors, the lobby design, the logo, all of that stuff. Espoused beliefs is written organizational goals, philosophy, mission. Okay, so the blonde hair, blue eyed guy, hey, you know what? I'm Pentecostal, he's Pentecostal. I'm Catholic, he's Catholic. You know what I mean? We're gonna have some same beliefs and some same values and the same ways that we were brought up. Those underlying assumptions, these are the unconscious but powerful beliefs and feelings, such as commitment to cure every patient no matter the cost. So we've looked even deeper into this gentleman or this young lady that we're after. And we know that they have not only our beliefs, but deep down, deep to their core, there's just something that pulls to you because you feel that great connection. You're probably never going to forget about that, are you? So whether it's traditional, progressive, or cold and indifferent culture, the organizational culture has a powerful and very profound impact on employees and the people served by the organization. Okay, so from facility to facility, this is different, and trust me, it is definitely something that you can feel. You may be a part of a traditional culture. They keep the status quo, so to speak. They do not seek out changes. They know the next person in line who's going to take their position when they retire. They've been planning that. Um, this one would be the good old boy culture. Now, if Miss Martin were sitting here with me, and we were talking about the traditional culture together with you, then she would say that good old boy culture is a group of old white men who've been there for 100 years, sitting around a round table making decisions that only affect them and only help them and their pocketbook. The progressive culture, these are organizations they're going to pursue the newest and shiniest fads or buy the latest equipment. Many of these facilities are warm, they're inviting, they appeal to the masses. Some are cold and indifferent to outsiders. Either way, these type of cultures have a huge effect on the employees as well as the people served by the facility. Because of this, organizational culture shapes and molds the behaviors and responses of the people. So now we're going to talk about a culture of safety. This happens to be a couple of places where I have a couple of YouTube videos that really irritates me that I don't know how to incorporate them into this. I guess if I did Google Meet, it probably would do so. But with the culture of safety, it's designed to bring about the best patient outcomes. Nursing shortages and limited resources due to increased healthcare costs make a culture of safety very difficult to obtain. Error-prone nurses are ones who feel devalued by an organization, have not been well prepared, or fatigued due to excessive workloads. These are important attributes. Do you hear that? Attributes for an organization for culture safety. Acknowledge the mistakes. Are they willing to say, we made an error in implementing da 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 da? Do they detect error-prone situations? Think about our quality improvement guys. Diligence in detecting errors and eliminating them. Those are some things that speak to the nurse. I don't know. I don't want to work somewhere where they don't want to do any error detection. They don't want to eliminate them. They don't want to make it. They don't want to improve upon it. They don't want to see quality. They would rather see the quantity. Is the organization empowering their nurses to bring about change for improved patient outcomes? Change aspects of systems that are error producing. How open are they to questioning the existing way of doing things? How open are they to hearing other voices? Patient errors continuing at alarming rates. Why? Why is that? Are they worked understaffed, mandatory overtime, and pressure to work harder and not smarter? And do y'all remember, if you listen to my quality improvement lecture, I directed y'all to a hospital website, or not a website, but it was a board that you could go to, and it graded hospitals around. So when you're talking about error-prone places and the culture of safety, and you determine what's best for you, go there and look and see. Okay, they have a lot of errors going on there, and this facility is at a 5 and that one's at a 3. Probably don't want to do that one. Care environments. Patients are less likely to be at risk of failure to rescue or death in an environment that continually seeks to improve the outcomes. Relationships with physicians, skilled nurse managers with high levels of leadership, with ability and emphasis on staff development as well as quality of care, are what make up a better care environment. Quality of care is an important part of the care environment. So you look at longevity and excellence factors. Excellence basically means do not settle for mediocre, and instead they continually strive to be the best. Are they going to be perfect? There's not one perfect facility out there. I mean, I'm like the next person. I wish there was. Meaningfulness. This means an organization needs a clear purpose, but it is not just lip service with words. It must be shown with the works. It's kind of like if your significant other, my blonde haired, blue eyed guy, which by the way, my husband's gray head and blue eyes. So I'm just using that as an example. But my blonde haired, blue eyed guy that I talked about earlier. So if he just said, I love you, you're the most important person in my life, or she, whichever way it went, and then they go out and they date around. I'm being really PG here. So they date around to other folks, um, and then they come back home to you and tell you how much they love you. But then they go out to the club and they club all night with their buddies or their sisters or their whoever it is down in, is BJ's honky tonk even exist anymore? I don't know. But I'm just saying, it's just lip service when they come in and they don't, they're just not showing you. If they were working on loving you and working on being caring, then their words wouldn't be empty. It would mean something. And it's the same with facilities. I want us facilities words to mean something. I think that's very important. Regard. Value your staff, value your nurses. Value is felt by all. We all desire to feel we are full of worth and valued by others, especially administration. Learning and growth. Do they provide mentors? Revamp a preceptor development program to help out new nurses or help you out as a preceptor? Do they provide education that speaks to all four factors? So organizational goals. Their mission statement must be aligned well with its day-to-day actions of the leaders. Goals must be clearly outlined. Survival, maintenance of an organization's existence. Many organizations are cash strapped, which pushes them further into survival mode by holding on to their assets and withholding pay increases or freezing hiring. We're seeing a lot of that in today's time. Survival is threatened when reimbursements are reduced, competition increases, the organization fails to meet standards, or patients are unable to pay their bills. Then we're looking at growth. CEOs typically want their organizations to grow by expanding into new territories. Think about Baptist for a minute. We are currently, we've been acquiring many new facilities over the years. 10 years ago, this would not have happened, but because of rising costs, many facilities can be snatched up by bigger ones. And so that's what's happening. I think Saline at one time was going to be bought out by St. Vincent. I think the deal fell through, but a lot of these little folks are getting eat up by the bigger folks because they cannot keep their head above water. The profit return monies to their owners. Not for profit must pay bills and operate in the black, but both have problems meeting that goal because whether they are a for-profit or not for profit, it is hard to stay out of the red in today's times. And what about their status? We're the best of the best, or we haven't come out with a motto in years, but like I think every year for 10 years we had a new motto, all our best, and I think that's probably just stuck around. Dominance. Do they acquire and overtake? It goes hand in hand with the status in today's market. So that growth is big for them, even though they might not have money to do pay increases. They're still going to figure out a way to snatch up these other little places because, again, it's profit for them. Structure is the traditional approach. Employees are ranked from top to bottom, and I'm going to show you that on the next slide. The number of people on the bottom is usually greater than the number on the top, and these individuals typically have zero power. Zero. Authority resides at the top, And though they distribute authority, they still retain that authority to reverse decisions or regain control. Look, I'm going to pass this down to you. I'm going to delegate this task to you. You're going to be the supervisor over such and such. But you can't really make changes. That's kind of how I see the traditional approach. Excuse me, power is distributed, like I said. Nurses fall somewhere in the middle of this ladder. Bureaucracy, that amount varies, is a characteristic of this formal operations that go along with these organizations. So here you go, that organizational hierarchy. This is what we typically see. We have our CEO who's at the top. He delegates down here to the administrators, to the managers, to the staff nurses. I mean, I look at where the aides and housekeeping and maintenance are. They're stuck on the very bottom. They have zero say in anything, and they see a lot of stuff. I'm wondering if that's so smart. Nurses are right there in the middle. And us nurses there in the middle, we get to try to hear what goes on with the technician, with the LPNs. I'm sorry, I don't know why they have technicians, but we get to know what's going on with them. We get to know what's going on with the aides, housekeeping, and maintenance. We develop relationships with all of these that are down under that hierarchy. And sometimes it's hard to build those relationships with those at the top so that our voice doesn't get heard. The innovated organizational structure, and this is non-traditional, it's kind of organic in nature. It emphasizes flexibility. I like that. Less centralized. Decisions are made by the individuals who will implement them, and they emphasize autonomy. So, innovative operations are more dynamic, they're more flexible, they're, again, less centralized than the traditional bureaucratic organization. Decisions are made by the people who will carry out the implementation process. The supervisors are more like planners and a resource for others. They act as coordinators between the teams so that all teams are working together and for the same shared goal or vision. Healthcare organizations around the U.S. are changing, many of them. They're joining forces with other healthcare facilities for a shared goal of being the best at patient-centered outcomes. And it is important to note that an organization who operates in this manner is one that we would call decentralized. So they're less centralized, so we call them decentralized. They allow for shared governance, and decisions are made by the one individual at the top instead of all. Wait, hang on. I am not going to record this slide again. I'm just going to correct my error. An organization who operates in this manner is one we call decentralized because they allow for shared governance. The decisions are not being made by just one individual at the top. Instead, the decisions are being made by all who are involved. I had my own little typo there. Processes are a way to get things done within an organization. There are two mechanisms by which these processes are carried out. There's a formal way and an informal way. A formal is designed for getting things done. Written policies and procedures hang out here in that formal arena. The informal, these are the processes that are not written. They often are not discussed. They are designed to get around the formal processes. Often it is a much simpler and faster route. So now we have to talk about power. I had to get some quotes in here. I thought that this was a perfect place to put that. With great power comes great responsibility. That was Spider-Man. The measure of a man is what he does with power. That is Plato. Power is the ability to do good things for others. Brooke Astor. And the best one of all, by Ralph Waldo Emerson. Before we acquire great power, we must acquire great wisdom to use it well. That is exactly right. Before I start this slide again, I'm just going to tell you that I cleared the whole slide, and you're welcome. I realized that I had rambled on about negative and positive power for about 5 minutes. I was like, they did not want to hear this. So we gave you something to kind of smile and laugh about. So power is the ability, and to go, whoo, thank you, Jesus. Power is the ability to influence other people despite resistance. The use of power can be positive or it can be negative. Power may be actual or it could be potential. A nurse manager gives a staff nurse the day or night off because they came in and picked up a different shift. So they change things around to work it to his or her benefit. Power may be intended or it could be unintended. So you got a negative. A nurse points out a physician error and is penalized then by being transferred to another unit and deemed a troublemaker. Then we have our sources of power. Authority granted to an individual or a group to control resources and decision making by virtue of position within the organizational hierarchy. I'm not up there in that hierarchy too far. Reward, the promise of money, goods, services, recognition, and other benefits. Expertise or control of information, the special knowledge an individual is believed to possess. Coercion is the threat of pain or some type of harm, which may be physical, economic, or psychological. So those are some pretty good sources of power there. In control of information, you would think that knowledge is power. If you do not have the knowledge, then you have no power in which to change it. So take as much power as you can. Know as much things as you can. I still read research articles, though sometimes I find it difficult because I promised myself after DNP I was never going to read another research article, but I like reading them, so I do it. I don't get to as much as I'd like to, but delve into it. Find out the things that you want to know. I mean, really hone in on your specialty and get that knowledge, because it's gonna take you a little further, especially when I'm telling you when you hone. Okay, I know you're probably like, just move on, Dr. Coucher, but I mean really hone. I'm gonna be transparent with you. I have my DNP, but I mean, yes, I like quality improvement, and I probably should be doing something in quality improvement and getting some more certificates. But I know a little bit about something along the way for a lot of different things. So if I can give you anything, any kind of power, it would be to know as much as you can about that one thing that you're honed in on. Get as much knowledge about that as you can, and then move on to the next thing. Don't have ADHD knowledge. That's a new one. Who has the power? Our managers? Yep. This is a given that our managers and administrators have power over us. What about our clients? Do they have power? Absolutely. The patient-centered care movement puts the power in our clients' hands. So complaints, they refuse to go to the facility, and then they talk about it. They're not going to go, and they talk about it to Susie Q down the road, and they talk about it with Billy Bob down the road, and pretty soon everybody's like, I'm not going to go there. And so word of mouth is kind of big. You know, a lot of people won't go to Saline Memorial because a lot of word of mouth. There's been a lot of bad things over the years. They've gotten better. It's a small hospital, and I don't have anything bad to say about it. But you know, that word of mouth went pretty far for them. It's not just that. Our clients have control over us because in that patient-centered care movement, we get the patient outcomes. If it's a negative outcome for the patient, it comes back down on us. If they fill out their Press Ganey and they decide that that Coucher woman, she was nasty, I didn't like her. Guess what? It's a bad against me. It's a mark against me. Assistants, what would happen if all nursing assistants chose not to show up to work? If you're not used to them, it probably wouldn't be any big deal. But if you're used to having them, then I'm sure it would be a big deal. Everybody's gonna be scrambling around to figure out what to do. There's not, I mean, when you are doing total patient care and you don't have LPNs on the med surg floor, and so you have all RNs, then you have to make sure you have enough RNs to take care of the total patient care of at least 5 patients. Nurses, RNs have the hierarchical authority and are critical to the healthcare organization. So we do have a voice and we do have power. We need to use it. What happens if we all refuse to come to work? What happened a few years ago? Anybody remember that on The View when they decided Miss Colorado was wearing her nurse costume with a doctor's stethoscope? Okay. That went over like a lead balloon, you know? There was a conglomerate of nurses who spoke out. It trended on social media for weeks of nurses in their nursing costume. I'm sorry, my leg was up underneath me. In their nursing costume with their doctor's stethoscope around their neck. So whoever the chick was that made the comment, there was an apology that went out from her because nurses have power. We have voices. What happens when one of us, whom we don't even know, was bullied and arrested for following hospital policy and advocating for her unconscious patient? What did we do? We nurses, as a whole, came together. It wasn't just about RNs. It wasn't just about LPNs, it wasn't about nursing assistants, it was about all of us together. We came together because she was advocating for that patient. I don't know if y'all remember that whole thing, but she didn't want to draw blood on the unconscious patient without his permission, I believe it was. And the police officer there got mad, but she couldn't do anything. She didn't have permission. She was advocating for a patient and she was following policy, but he decided to be a bully and a total jerk and went after her. And so consequently, we nurses had a lot of power with our voice. There was it was another thing that trended on social media for a while. So this moves me into empowering nurses. I love this part because I think that as a whole, we could all do great things if we just come together. So what does feeling empowered include? Nurse empowerment. We can individually or as a collective group maximize our power. Again, I brought out The View and the host there. Conger and Kanuga referred to empowerment, and I probably said his name wrong, as an elevated state of motivation caused by expectations that are optimistic of a reward for efforts. The feeling of empowerment includes self-determination, feeling free to decide how to do your work, meaning caring about your work, enjoying it, and taking it seriously. Competence, confidence in your ability to do your work well. And impact, feeling that people listen to your ideas, that you can make a difference, and you will make a difference. Contributors to empowerment. Participation in decision-making autonomy. This is control of nursing practice within an organization, the ability to act on the basis of one's knowledge and experience. Manageable workloads. Expectation, I expect that, you expect that, of reasonable work assignments. Reward and recognition. Appreciation expressed as tangible, those raises, and intangible praises. I like this, but I also like to hear, Coucher, you're doing a great job. What you did and what you said the other day to that patient or these students, it was, I just can't thank you enough. it brought meaning to me. I like hearing that. I like to hear thank you. I like to hear you're doing a great job. I mean, don't we all? Fairness, we want fairness. Boy, this is another one. I guess you can tell I like this part. Equitable treatment of all staff. I am about being equal. I was never one of those charge nurses that came and looked at the board and was like, well, I was here yesterday. I'm charged today, but I'm just gonna give that patient to so and so. I didn't do that. That difficult patient was still my difficult patient. I would give other people the easier assignments and take the difficult ones for myself because I did not want my team to feel like that. I just wanted them to know that I cared. And I probably shouldn't have done that sometimes, but I just I just like to be consistent. I like to be uh, equitable to all. How'd y'all like the way I said all that? Nurses need opportunities to be involved in decision making. If managers and high level administrators would listen to the voice of the nurse, give them opportunities, then we could change the environment in which we practice. Why is that? Because we're practicing in it. Disempowerment, of course, is being the opposite. Places nurses in a place where they are unable to control their own practice, which leads to frustration and sometimes failure. Ultimately, the nurse then experiences burnout. Okay, so shared governance. In shared governance, the nurse may be included in the highest level of decision making within the nursing department through representation on various councils that govern practice and management issues. These would include practice councils, unit budgeting and scheduling that would have input into the budget and the scheduling that goes on, committees, being a part of committees responsible for reviewing current practices, and then peer reviews. Note that your text states genuine sharing of decision making is difficult to accomplish, partly because managers are reluctant to relinquish control or to trust their staff members to make wise decisions. I think we see that a lot right now. You will find nurses sitting on the hospital committees, but sharing does not occur until our voice is heard. We can go sit on all the committees we want to go sit on, but unless we're going to be able to speak and our voice be heard that this is not practice, that it's not evidence-based. I've been looking at the research. I've seen what this in practice. I've seen this with my patients. Until our voice is heard on those committees, it's really going to amount to a hill of beans, in my opinion. I encourage nursing students to get involved, get a year or maybe two, then start sitting on your committees and sit in those meetings. Go to several of them. Just tell your supervisor, I want to know when these committees meet because I want to go sit on in there and listen. I want to find one that speaks to me. I want you to start being a voice for your patients and for other nurses. Professional organizations are a way to collectively allow the voice of the nurse to be spoken and heard. It is a way for our voices to band together and become one very large voice. Professional organizations empower nurses by providing collegiality. That's the opportunity to work with peers on issues important to the profession. Advocacy, commitment to improving the health and well-being of the people served by the profession. Representation at the state or province or national level when issues of importance to nursing arise. Hey, we follow your state board of nursing. You'll know when there's times that we need to be there in the courtroom, and we need to be there for the Senate or Congress because we need as many nurses' voices that can be there to be there. Enhancing competence. Enhancement of nurses' competence through publications and continuing education, and recognition of achievements. That's through certification of programs, awards, even social media. It's a way to do that. Collective bargaining uses the power of members, the power of numbers for a common cause. When people join for a common cause, they can exert more power than when they attempt to bring about change individually. Our voice and an effective collective bargaining contract can provide considerable protection to employees. However, there is a downside. Because it is the use of coercive power, it may actually encourage conflict rather than cooperation between employees and managers. Reasons a group of nurses may start to collective bargain would be, or a collective bargain contract would be for employee protection and employee benefits. That's when you weren't able to get it before. You've been trying, so now you're gonna have to coerce it out of them. Enhancing expertise. Most healthcare workers are empowered by their knowledge and competence. What I say, knowledge is power. So how can you as a nurse enhance your expertise? Participate in interdisciplinary team conferences. Some of my students in the past had the opportunity for this as Dr. Jarrett was working on her DNP project. It was pretty cool. So she was doing interdisciplinary team conferences, and she did it as a project on BHAG. And so the students were actually in on some of these conferences. Take advantage of CEU offerings. Attend conferences. Let me just say, if you see a conference come across your email that would enhance your practice, go for it. Go do it. Afterwards, present the information to your peers. Keep your reading up to date. Most of you will leave here and think, nope, not reading another line, but don't stop. See, I told you, I did that. Participate in nursing research. Observe experienced nurses and nurse leaders. Finally, conclusion. You're like, whew. Becoming and remaining empowered requires active participation. I want you to seek organizations whose organizational cultures are a fit with your professional goals. Date that organization, determine if they're a good fit. They can't just be cute. They can't. And above all else, walk out of this classroom today, your own classroom in your house, with the base knowledge you need to practice as an empowered nurse. Continually better yourself. Don't stop until you're satisfied with where you are in your career. Be a leader. And guys, thank you. Good luck to each of you in your future nursing career. I hope and pray you become leaders for tomorrow for better outcomes for the nursing population and patients. I wish that we could have spent more time together face to face, but when we're together, I have enjoyed y'all. I've enjoyed clinical. I've enjoyed the relationships. You guys, get out there and achieve. Be all that you can be.